Namaste everyone. This is myself, Dr. Manjit Kumar, MD Internal Medicine, practicing as a consultant nephrologist attached with the Apollo Hospital, Kolkata. Basically, as we know, this is the month for kidney disease. So, kidney being a very important organ of our body. So, we'll basically talk about how to prevent or how, as we know, prevention is always better than cure. So, it's better we need to know something about the kidney function, something about the how to protect the development of any kidney disease. So, as we know, anybody who is having diabetes or hypertensive, as we know, these two diseases, there's a very much important role playing in the development of kidney disease. So once the person detected with the diabetes or hypertension, we must know the kidney function at the earliest, and we try to prevent the development of further any kidney ailment. For that part, we need to monitor the patient who is diabetic and hypertensive. We ask them to come for the follow-up, regular follow-up, so that we can control their BP, we can monitor their the kidney impairment developing due to high blood pressure and sugar. So, what are the basic parameters to look for development of any kidney ailment? So, we basically check the renal parameter even at the first follow-up. Once the person coming to you for a follow-up, then we should check the kidney function test like urea creatinine, so that we can know the basic level of their kidney function, and accordingly we'll advise to monitor their BP, regular checking of their blood pressure, and always ask them to control it under the measurable value. Like BP must be under control for any diabetic person who is having high blood pressure. The blood pressure must be under control, like 120/80 or 130 is the target level. And we should check their urine very oftenly. We'll ask them to monitor their urine. If their urine output is going down, or they're seeing any changes in the color of the urine, the quantity of the urine, or any fluid is coming in the urine, so we must monitor their urine also. And we need to see by doing this just simple urine dipstick routine urine test. This is very cheap nowadays. We can get it done at any moment of time, so that we can look for any passes of the sugar or protein in the urine. From that, we can conclude the development of any renal impairment, and we can modify that medication accordingly to stop the passage of sugar or protein in the urine. And before going for the pharmacological therapy, like medication therapy, we need to ask them to modify their lifestyle, which consists of mainly three factors. First of all, they must restrict their salt intake, because salt itself causes the shoot up their blood pressure and causing the retention of the fluid inside the body and further increase in the blood pressure. The salt restriction, that even for a normal person, the salt must be restricted even up to the 2 grams per day will be enough. And if it increases beyond that, there is high likely chances of getting various impairment in our body. The salt restriction is the prime importance, and the fluid intake must be somewhere around, for a normal person, 3 to 3.5 liters a day is acceptable for the normal metabolism of our body. And the carbohydrate content of our food must be cut down, so that we can further prevent the development of hyperglycemia, that is the blood sugar in high sugar in our blood, and so the further impairment of the kidney function we can halt there. So this salt restriction, the carbohydrate restriction in our food, and even the various fatty food like polysaturated food must be avoided in our food. And we must ask these people to take plenty of vegetables in the food, so that they will get the minerals, vitamins in their adequate amount in their food. And for any diabetic person, the fruits must be advised to take either apple or papaya or even guava. These fruits, as they consist of less of fructose, and that's causing less enhancement of the sugar, and further the kidney impairment will be halted basically. And the lifestyle modification consists of restriction of the various addiction, like having alcohol and smoke. This must be even stopped if possible, or the quantity of intake must be very much reduced, or if possible, we'll ask people to stop the further consumption of any alcohol or smoke or any kind of drugs or good gas, tobaccos and all. This should be avoided, so that we can further prevent the progression of any kind of kidney impairment or diabetes or blood pressure or so. And the person must have the regular physical activities a day, like 30 minutes of any kind of activities, including cycling, jogging, or even any kind of cardiac exercises, yoga, and all. This can be also help in moderating or preventing the development of obesity, overweight, that will be further beneficial in controlling the blood pressure and sugar. So definitely, as being a kidney month, this March is the kidney month. Kidney health month is considered as a kidney health month. So these are the factors we must focus. Well, because see, basically, once this kidney impairment or kidney failure develops, then there is no medication to stop the development of the kidney ailment. So we always there is we must focus on the prevention. As we know, prevention is better than cure. So as there is no medical management for kidney failure as such, as there is only fees, such kind of management therapy for any kind of kidney failure. If the patient landed with the end stage renal disease, then only we have the three options. Like either the patient may require dialysis at any point of the time, or if there is peritoneal dialysis, kind of dialysis which can be done through the abdomen. And there is another one that is called kidney transplant. So we must focus, we must follow up the persons so we can prevent the development of the kidney failure as such. For that part only, we'll always ask the people to monitor their lifestyle, to consult a physician or doctor whenever they feel like having such kind of issues, like the blood pressure is not getting under control, the sugar is not getting under control, and they're developing edema, kind of swelling all over their body. If their urine output is going down, and they feel like anorexia, means loss of appetite, not able to take the food. Whenever they will have the food, they feel like nauseating all the time. If they feel breathless, like sometimes if the person is developing kidney impairment, the fluid may accumulate in the lung, causing the difficulty in the breathing. Even the person may complain this increase in the breathing problem once the person is lying down. So these are the various problems, various symptoms that can patient come to you and they will explain all this. Basically, we must focus on the various aspects of all these diseases which causes the development of kidney impairment, so that we can stop the development of kidney failure, and we prevent the going for the option like dialysis and kidney transplant. So basically, always prevention is better than cure, and we must focus on the preliminary aspects. So we must follow the various simple steps. Ask the person, ask the people who are diabetic and hypertensive, come for the regular follow-up and get themselves tested for their renal impairment. And if so, if they are in the initial stage of the development of renal impairment, where we can act very efficiently and can stop the further development of renal impairment without requiring the management of kidney failure as such, and we can definitely prevent the development of end-stage renal disease and helping them out, and we can help them out getting this drastic problem, which is the end-stage renal disease, which is very much tiring. It is exhaustive kind of chronic disease, which may drain you like anything. It will physically make you very weakened, and it's even various having mental. Patient may become depressive also. Sometimes we see the patient has so much depression after developing this kidney failure, they may even try to commit suicide also. That's why we always try to prevent the development of any kidney impairment, and we can ask them to come up for the follow-up whenever they're having any kind of primary disease, which are responsible for the development of kidney impairment. And even the person who are having any kind of family disease, like any kind of impairment in their family, like kidney related issues, or the person in their family running with any kind of ailment causing renal impairment like diabetes and hypertension, we ask them to come for follow. And there are various other few diseases themselves that can cause some kind of acute kidney injury, which can be completely curable. So these are the basic things. If we focus on these basic things, how to control the diabetes and hypertension and the various primary problems which are responsible for the development of the kidney impairment, we can save the person from the this kind of drastic disease. So my take home my message will be for all the people who are diabetic or hypertensive, or they're a little bit of obese, having various kind of family history of kind of metabolic disease in their family. They must come forward. They must get themselves checked at least once in a 6 months or 1 year, so we can detect any kind of renal impairment developing. We can detect earlier, and we can prevent the development of any kind of drastic disease. So this will be my only message for everyone. And again, I will stop my talk here. And thank you for kind listening to my this very informative message. Thanks all.